नमस्ते। इस महीने के गेस्ट लेक्चर में आप सबका बहुत स्वागत करता हूं। ग्रेसफुल लिविंग के प्रोग्राम्स अभी थोड़े थोड़े बदल रहे हैं, कुछ नई चीज़ें भी उसमें लाने की कोशिश हम लोग कर रहे हैं। नए नए टैलेंट्स है लोगों के साथ में, उस टैलेंट्स को भी हम उजागर करने के लिए नए नए प्रोग्राम्स कर रहे हैं। तो इस प्रोग्राम में मैं आप सबका स्वागत करता हूं। आज की जो हमारी गेस्ट है, उनकी पहचान कराने के लिए मैं पंडोल सर से रिक्वेस्ट करता हूं। सो ही विल इंट्रोड्यूस हर, देन वी विल स्टार्ट द प्रोग्राम. Now over to Mr. Pandit.
Hello.
Yeah.
Everybody can hear me?
Yes.
Yes. Good evening to everybody. Warm welcome to all of you.
Good
I
evening.
hope that today's program, which is going to be hosted by Dr. Pervin Dadachanji, will be something of use to all of you. This is being done through the offices of Graceful Living and Tulsi Trust. Tulsi Trust is a trust which has been in existence for the last 75 years and is got to do with education, skills learning and things like that. And one of the main objectives at the moment is to look after the health, both mental and physical, of seniors. So Graceful Living is a new organization, and I hope that you, all the listeners, will take use and make use of today's program by Mrs. Dadachanji. She's a psychiatrist with special interest in child and adolescent psychiatry, and today she's going to speak about depression. Mrs. Dadachanji has a private practice in South Bombay and has been practicing for the last 25 years. She writes books and she talks to children, parents, and elderly on all sorts of problems that may affect them as far as their mental health is concerned. So in today's time, when depression is something that is almost affecting almost everybody, I think that what Dr. Dadachanji is going to tell us and explain to us is going to be very useful and is something that we can all appreciate, because many of us, whether we like it or not, and in fact, whether we know it or not, do have some form of depression or the other. Mrs. Dadachanji's experience as a consultant psychiatrist at Umeed is another feather in her cap, and also at the NHSRCC Children's Hospital in Mumbai. She's also a consultant at the Parsi General Hospital in Mumbai. So without taking up too much time, I would request Mrs. Dadachanji to take over, speak about what she knows about depression, how it affects all of us, and at the end, if it's all right, there will be a short question-answer session. So I return to you, Dr. Pervin.
Thank you. Thank you very much. I'm just going to share my screen and
yeah.
Okay.
Yes, we can see it.
Yes,
Yeah,
that's good.
Okay. Yeah. All right. Okay, so good evening, everybody, and I'm very happy to be here to talk to you all about depression in the elderly, which I feel is a topic which is not talked about enough. You know, we talk a lot about children and adolescents with depression because we hear a lot about children dying due to suicide, they have suicidal attempts, etc. We somehow don't speak about this in the elderly. And I have had so many situations where the elderly have tried to end their life. And that is one of the things which really concerns us as mental health professionals. So let's look at, can you see the next slide? Is it?
Yes, we can see it. Yeah.
Okay. So, so facts about depression in late life. So it affects several million Indians. I don't know the exact figure, but it is quite a lot. And only 10% get treatment for depression. So while you'll get treated for hypertension and you will get treated for maybe for dementia or for cardiac disease, etc., you very rarely get treatment for depression because it is not recognized. depression in the elderly is very different from depression in the young adult or the adult. So that's why it is not recognized. A lot of doctors miss it. Also because there are so many illnesses. So one feels, oh, this person is looking sad because he's got Parkinson's. If the Parkinson's gets better, he will feel better. Or a cardiac disease हुआ है, तो इसके लिए obviously कुछ interest नहीं है, so that kind of thing goes on happening in about depression in the older group. Now, the clinical features of depression in the elderly is very different from young people. When we think of depression, हम लोग क्या सोचते हैं कि depression is कि the person is sad all the time or is feeling, crying all the time, etc. But it is often not that. In fact, in the elderly, depression comes up like this. There is a sense, of course, let me tell you that just because you are tired does not mean you're depressed. But if all other causes of tiredness are ruled out, it could be that depression could be a sign of, tiredness could be a sign of depression. Sleep issues. I think a lot of elderly, all of you must have had some sleep issue or the other. So sleep issue, okay, pain is different, but a sleep issue where everything has been done and there is still, the person finds it very difficult to sleep. Often what happens is in depression, it's more than going off to sleep. It is waking up early in the morning and then worrying, okay, what will happen? Will I be alone? Supposing my wife dies, my children are living abroad, what will they put me in a home, etc. So these things happen when you wake up early in the morning. An other sign of depression in the elderly is irritability, getting irritated over small things. Some small thing happens and you blow your fuse. Confusion can also be a part of being depressed. In fact, confusion can be a part of many things. We'll talk about it in terms of dementia later, but this can also be a sign of depression. Then also paying attention. People often in depression, especially, what happens is because your concentration is poor, you feel you forget. And when you forget, लगता है कि, मुझे dementia हुआ है. I think or relatives or children will say, this means that, he's forgetting. That means he has dementia. It could just be that you are not able to pay attention. When we don't pay attention, we forget. So it's not a real memory loss. Then not enjoying activities they used to. So if you were happy to watch TV and you looked forward to watching a TV show, and now there is just no interest, forget it, I don't want to watch it. Movements become slow. There is also a change in weight and appetite. Usually there is a reduction in appetite and therefore a loss of weight. But some people do what we call comfort eating, where you eat a lot and because your movements, etc., are slow, you tend to put on a lot of weight. Then actually the next one, where you feel worthless, you feel guilty that, oh, I did so many bad things when I was a young person. I should not have been so mean to my child. I shouldn't have hit her, or I shouldn't have taken away money from someone. So these are all guilt feelings which suddenly sometimes come up in depression. And this feeling that what's the point of life, it's all not necessary. I feel hopeless. And along with the hopelessness also comes suicidal thoughts. So if suicidal thoughts can be, what's the point of this life? I have no purpose in it. To, I think I would be better off dead. I'm a burden to people. To, what can I do to kill myself? And trying to, collect medicines or something to end your life. So suicidal thoughts can be this way. And a lot of people, especially elderly, they come out in the form of constant aches and pains. So pains which every doctor you go to says that there's nothing wrong, you don't have any pains, but those could mask your depression. Now, what are the risk factors here? So who are the people? Risk factors means who are the people who are more at risk for depression in old age than others? So being single, unmarried, divorced, widowed, or even female are more risk factors. In fact, in the females, there is more depression than in the males. Then having no support. I think all of you may have gone through this during COVID, where social support was removed. So that is and I have seen a lot more depression during COVID because there is social connectedness has gone. Then there is stressful life events. It could be the death of a spouse. It could be financial issues. These are also risk factors. Like I remember years ago, I had seen one patient of mine whose father he was in his late 60s. He ended his life because he had some big financial problem. So these are stressful life events are the risk factors. Then any physical illness, especially if it is chronic, like stroke, cancer, heart disease, these are also quite likely to make one feel that depressed. Some medicines can cause depression, like if you are taking some form of steroids, this can often cause depression. Then dependence, where you feel dependence, or can we ask that person to please be please mute?
Yeah, somebody should mute themselves. Too much disturbance.
Yeah, can everyone mute themselves, please?
Yeah, we'll do that.
Yeah.
Yes.
Yeah, because then I think it's disturbing for everyone.
Yeah. Okay, I've done that.
So I was talking about dependence. You know, when people feel that they are dependent on their children or on a spouse who is also equally old, or they need to be put in a home, etc. These are also risk factors for depression, as is disability in any form. So now we go to the other risk factors in depression is if you've already had a depression in your family, or you have had depression in the past, or you have had a suicide attempt in the past, or you live very alone, totally socially isolated, and you've lost a loved one. All these things are also risk factors for depression. The last one is people who tend to, if you know of someone who was not, say, drinking at all and has suddenly started drinking, it could be that there is depression which has caused this person to drink. Now, why do we need to treat depression? I mean, the reason why I'm talking about depression to you is for you to find out if you have it or if you know someone who has it. So why do you need to know? Because a lot of doctors they miss depression because they think it's normal, that it's normal to feel like this at this age. No, it is not normal to feel. You may feel low, or you may feel disinterested, or you may not sleep or feel tired, but it's not chronic. It's only for a short period of time. So also there have been studies which have shown that if you don't treat depression, the chances of cardiac disease is much higher because of the depression. The chances of dying are much higher because of depression. And I'm not talking about suicide. I'm just talking about other illnesses which can occur. And of course, if you are depressed and you are not able to, supposing you've broken a limb and you are depressed, your chances of rehabilitating or your chances of getting better are much higher. So for example, I get called in quite often at the hospital where there has been someone who has had a cardiac issue, or that person has had a broken a limb, that the doctor will feel that, oh, the surgery has gone beautifully, but the person is still not able to start walking. So this is something that is why we need to treat the person. So what is the treatment that we have? I am not going to talk in details about this because I don't, but I just want to tell you that we have a lot of help available, especially in the form of medicine. So I'm not going to talk about these medicines, but there are so many medicines available for depression. And how do medicines help? Because medicines, when you get depressed, there is a deficiency in the certain chemicals in the brain, like serotonin or epinephrine. So when you give medicines, the serotonin levels, the norepinephrine levels come to normal and the person starts feeling better. So it is a physical illness. Depression is a physical illness, just like diabetes or hypertension or whatever. You treat the chemical imbalance and the person feels better. The only thing with treatment in the elderly is that, don't, like your doctor gives you, say, antidepressant medicine. You don't feel good after 1 month, don't stop it, because in the elderly, the medicine may take 2 to 3 months to show improvement. And always in the older generation, we give very low doses and slowly bring them up. So medication is a very good form of treatment and often may not be needed forever. It may be needed for, say, 6 months or for a year while you are grieving for your spouse or while you have had some chronic issue which you need to deal with. Sometimes you also, I'm sure you all have all heard of shock therapy, which we don't give very often, but shock therapy also works if there are people who cannot handle the side effect of medicine, or they are suicidal, or they are severely depressed. So we give shock therapy too. Then the other thing which is very, very useful is talk therapy, or what you call counseling, or you call it psychotherapy. So this is really important for a lot of people who have mild to moderate depression, where you may not really need medication. Plus, also sometimes depression is due to a life stress. So you have lost a friend, or you have moved homes, or you have health problems, and you may not want to take medicine. And so talking to someone who can help you to handle that stressful period, to relieve you of your depression, would help. And some people don't want to take medicine for whatever reason, which I feel is sometimes it's just the stigma of taking meds. But if you don't do that, you can also be on, do therapy. What happens, sometimes what we feel is that at this age, how is the person going to change? It is not about the person changing. It is just about the person changing his way of thinking because he is depressed at that time. And along with talk therapy, what really helps is, I think you all probably have groups, self-help groups, support groups. These also help people to feel better with in terms of treatment. Now, before I end my talk, I just wanted to talk about sometimes what happens is that there is a big mix-up between, is this dementia or is this depression? So why do we think that dementia and depression are similar? Because of these things which I have put. Because loss of interest in normal hobbies, loss of interest in things is there in depression and dementia. Withdrawal from society or from family or social situations is there in depression as well as in dementia. If you remember earlier, I also spoke about forgetfulness, right? That in depression you forget, but you forget not because of real changes in the brain, but you forget because you have not focused. Your concentration has been poor. Sleeping too much or not enough, again, in depression also this happens, in dementia also this happens, and concentration issues occur in both these. So because of which one may mistake dementia for depression. In fact, earlier we used to use this word for pseudo-dementia for depression, but it was a pseudo-dementia. What are the differences now? So mental functioning reduces rapidly with depression. I mean, with depression, it happens very quickly. So for example, the person who is, the person who suddenly you feel that, oh God, she's just forgetting things very quickly, you would think more of depression than of dementia. People with dementia are very disoriented. They are very confused. They don't know what is happening. While a person with depression, if you bring them back to reality and say, no, mom, you are in your home, she will say, oh yeah, actually that is true. I am in my home. I can see my curtains. I can see my paintings, etc. People with depression have difficulty concentrating. I talked about it earlier, whereas those with dementia have problems with short-term memory. So they forget. While people with depression, they only cannot concentrate. And all these writing, speaking, motor skills are not affected in depression. You don't tend to forget things which like cooking, you will not say, oh, do I put sugar in this or do I put salt in this? That kind of forgetfulness and all is not there. And depressed, when you are depressed, you often know you are depressed and you want to do something about it. While a person with dementia will never feel that they need to do anything. So this is my short little talk because I thought that it would be better for me to ask you people if you all have any questions about this. The reason for this talk was that if there is even a hint of depression, go and meet a counselor, go and talk to your GP. Your GP will also, there is often very little medications can be given, for depression, and it can help. So now I'm ending my talk and I am just going to leave it open to anyone to
Doctor, my name is Deepak Shroff and I am suffering from depression since last 25 years and I am under the medication of Dr. B.R. Agarwal. I would like to say that people think that they don't go to doctors because they think that you are mad or what. Actually, a lot of consciousness of psychiatrists has to be developed so that people, if they have depression and with medicine, I am leading a normal life.
Yeah. Thank you for sharing, because that is really very important, that you can lead a normal life with...
I'm leading an absolutely normal life. Though there are fluctuations in between, I have symptoms again, but with medication, it again takes me back. Right. I am able to do and I am 63 now, so I am able to do my routine maximum times.
Right. And if you hadn't been on medicine, it would have been so difficult for you.
Oh no, I will go crazy and my house will go crazy.
Right.
So I would request all the senior citizens to go for a psychiatrist and definitely have patience, because psychiatric medicines take time to settle. Many times doctor have to change the medicine till you settle down. So they should have patience of 6 months to 1 year.
Okay.
Okay, I don't think I need to be spotlighted now, no? We can have, people can just ask questions.
I raise my hand. Can I ask the question?
In this system, the person who speaks, he gets spotlight. That's the only thing.
Okay.
Yeah. Okay. Yeah. या नयना देसाई ना प्रश्न विचारा. या विजूताई मग तुम्ही विचारा. Mrs. Desai, unmute yourself and then ask the question.
Unmute. Yeah, you're okay.
Yes, it's a very good lecture. I have no question. All questions are solved.
Okay, thank you very much. That's very sweet.
It's a very good lecture. Thank you very much.
Thank you. Anybody else?
Yeah, it's me, Riju Chavan.
Yeah.
Yeah, I'm a senior citizen, of course, 70 years now. The life is full of problems and there is bound to be a depression at some time, in your life. And we try to face it, but at times, when you go to the psychiatrist or you go to the doctor and when you discuss about your problems, they feel, oh, you're in depression. So first thing, the depression could be for so many various reasons. Even at young age, there are different subjects, but old age, though you have lived your life, you have earned money, but there are small things now. During the corona also, people have gone into depression because there was no social life as such. But when you have been given a medication for antidepressant as such, is it very addictive? Because I have seen and I have experienced that the medicines are very addictive, and you are zombie most of the time after taking the medicine, and you lose your control over your mind, and you can't clearly think about it. So is that you have to come out of it on your own, manage it on your own? Because I think medicines are, up to certain extent, medicines will help you.
Okay, so I think you've asked a very relevant question because, I think people have a lot of misconceptions about medicine. So to tell you, the first thing is that most of our psychiatric medicines, and now we must be having more than 100 different types, are not addictive. There is a very small group of medicines which are addictive, and those medicines are not given by psychiatrists mostly. They are given by general physicians because, which are given for a short time, but then people just take them, continue to take them. Those are addictive. So most of our medicines are not. This zombiness which you are talking about also is not due to any of the medicines. It's often due to certain disorders also, which you would see. Certain disorders make the person look, that eyes are glazed, etc. It's not necessarily due to medicine. I will not totally dispute you about this, because there are doctors who give and psychiatrists who give lots of medicines. They'll give
yes.
5 or 10 different medicines, which especially in the elderly we should not, because there are too many drug interactions.
Correct.
So, but all our medicines are not addictive. And as I said earlier, normally, you have a problem, we give medicines, you get better, that situation is resolved, one can even stop the medicine. It doesn't mean that you have to go, I think that's another thing which we feel, that mental health issues, that means for years you have to take. Not always.
Another thing, moment you go to the psychiatrist, people think isko kuch problem hai, screw dilla ho gaya hai. That kind of a thing.
That stigma we need to, as Mr.
Yeah, but with the age and there are daily basis small problems which leads you to the depression, and then you, from the depression, you go into the dementia, as you said it. So which is the cutoff line and how to control that on your own before? Because when you have tensions or something happens against your wish and desire, you get into the depression. Then how do you control your mind? Of course, there is a yoga, pranayam, everything is there. You do that, but then certain things upset you in the life, though it may not be a major event, but then too, that when you go into dementia, so how to stop yourself getting into dementia from depression?
This is wrong. Depression does not lead to dementia. They are completely different entities. You can be chronically depressed and you will never have dementia, and you can be the happiest person on earth and you can get dementia. So one does not lead to the other. They are completely different entities. It's just that they have very certain things which are similar. So you may think, oh, ye dementia hai, ke depression hai. So that's why I was pointing out the things.
You need to differentiate that very well.
The only thing is that if you don't see dementia, treatment is very little, but depression, there is a lot of treatment available. So why not treat it? So if it's untreated, it becomes chronic depression, but it will not turn into dementia.
Oh, okay, but how can you stop yourself getting into that severe stage? You know, on your own, there are certain small things. Like getting into the severe depression. Of course, socializing and entertaining.
Socializing
is very, very important.
Socializing is very important. Keeping yourself busy by either joining, doing some hobbies or getting,
social work, helping others. That is the best way.
Doing exercise. Exercise is absolutely fantastic for, to be able to go for that walk every day for a little while is very good. Doing a little yoga, doing meditation, mindfulness, all these things help. But having said that, they are not the treatment only for somebody who has depression. It's like in diabetes, you will tell the person that, okay, go for a walk, be careful with your diet, etc. But will you stop the insulin or the medicines? No. So it is similar that for depression, talk therapy or medicine is the important part. The other things all help. Doing exercise helps, yoga helps, etc. All these things you can do, but the major treatment is either psychotherapy, which is counseling, talking, or medication.
Okay, right. Thank you.
You're welcome.
Doctor, once you start taking medicines, do you have to continue lifetime?
No, as I said earlier, that in every case you don't have to. Some cases may have to, especially if they are where depression has occurred without a reason. Then it is often talked about as a chemical imbalance. But supposing depression occurs because of a certain situation that, you broke your leg, now you can't walk for 3 months. So you feel depressed and we give medicine, and after a few months, you stop with the medication. So always it is not lifelong. In fact, I see lots of cases where I have given medicine and I've stopped it.
But then any possibility of revival or relapse?
So this is again, psychiatry has not developed so much that we can 100% say, but there is always a chance of a relapse occurring, but then there is also a chance that it will not occur again.
And finally, the family has to have a lot of interaction, involvement as a part of the treatment or not? Family members?
Yes. So we often say that, when we look at psychiatric illness, we always look at involving the family, because the family needs to be there to support the person with mental illness. Also, the family needs to understand that, you just telling your father that, come on now, just get out of it and go for a walk, everything will be okay, doesn't solve the problem, because it's a disease. It's not just something which you are doing in your head. So that is why, and family to be able to be more involved, family to take over certain burdens initially, because when people are depressed, they are able to do so many things. For example, they will not cook because they don't feel like eating. So then there will be all that other issues related to starvation come in. So family members, if they are educated about the nature of the illness, it helps a lot.
Can I ask a question? You know, when you, like someone was saying, when you take these depression medicines, you can't stop suddenly. It has to be gradual. How true is it? I mean, in what way? What is sudden? What is gradual?
Again, it all depends on different medicines. There are certain medicines which you can stop suddenly and nothing will happen because they reduce in your brain very, very gradually. But some, if you suddenly withdraw them, they will give you withdrawal. But the rule of thumb normally is to reduce very, very slowly. Why? For two reasons. One is because when you withdraw, suddenly somebody is already getting this medicine for 6 months and then you just stop it, there will be a complete reduction in the medicine in the brain. So that will cause withdrawal of the medicine. Another thing is that when you reduce the medicines slowly, you also, if there is a problem, you can immediately, so for example, if the person, I'm reducing the medicine from 10 milligrams to 7.5 milligrams over a period of a month. After a month, maybe the depression symptoms recur. So then I know that I have to again increase the medicine. So medication in psychiatry usually has to be reduced over a period of time, gradually. It is very important to do that. Sudden stoppage will cause problems.
Thank you.
Anybody else with any question?
Yeah, Dominic, you say?
If there are no more questions, then we can come to the conclusion of this session now. I request Asha ji to conclude the session.
Yeah. Okay, doctor, it's been great having you. In fact, we haven't had, psychologist, psychiatrist, whatever, clinical earlier. So we were all looking forward to it. And I think you've explained it also well and simply. It seems to be fine with everyone. Yeah, thanks a lot. Thank you from Graceful Living and Tulsi Trust.
Thank you very much, everybody.
Thank you. Yeah.
Okay. Bye.
Bye.
Bye. See you.
जाते जाते एक और सूचना मैं सबको देना चाहता हूं कि on 29th we are having a program of multilingual songs. मराठी और हिंदी छोड़ के दूसरी भाषाओं के गाने हमने रिक्वेस्ट किए लोगों को. बहुत लोगों ने उसमें रजिस्टर किया है. For this one, it's a very interesting program. I request you all to join that one. अप्रैल में भी जो प्रोग्राम्स होंगे उनकी लिस्ट हम जल्दी पहले ही आपको दे देंगे ताकि आप सब लोग अगवा रहे कि ये प्रोग्राम को आपको अटेंड करना है. That we will do. 9th वाला प्रोग्राम आप जरूर अटेंड कीजिएगा and we will definitely meet on that. Thank you very much. आप सब लोगों ने इतने सही से मैं आप सबका आभारी हूँ और आज की इस मीटिंग में आप करते हैं. बहुत बहुत धन्यवाद.
Thank you very much.
Thank you.
मीटिंग संपली थी.